make assumptions.
Yes.
Sure.
In the meantime, as you say, you've got so much wisdom, yet it's, it doesn't completely compensate for the fact that you look slightly older.
So we've got a number of SMSs, and we will try and get through all of your SMSs, and you're also welcome to call us. Please that you're SMSing, you can continue to do so. We've still got a bit of time, 37420, so join us in our conversation and tell us about your issues. We haven't even touched the majority of the procedures yet, so we would like you to go through those. So, but you can call on 0861 242436, 0861 242436. We have an SMS here from Jenny. She says that I know that I'm a pretty girl, but I've been embarrassed my whole life about the fact that I'm flat-chested. Is there a non-surgical procedure that can enhance my breasts? I don't want to have an operation.
Look, there is a procedure called Macrolan, which is a much denser filler, and you need a lot of it, and you have to have a plastic surgeon do it. I wouldn't go to anybody else because they know, the exact place to place this filler. But unfortunately, it costs a lot, doesn't last as long. I don't have much experience with this because I don't do anything that, we don't do procedures that plastic surgeons should be doing. And it doesn't, as I say, so if you want a breast enlargement, rather go for the proper, for the real thing.
And rather deal with her either what she hopes for and what her expectations are about having fuller breasts, and then perhaps counsel her into what to expect from the surgery if she decides to go for the surgery. So you've spoken about non-surgical procedures that I thought they're actually primarily to do with the face, but you've spoken about the fact that they are useful for the body as well. Can you just run through some of the major things that you do and your clinics do every day?
One of the big problems that people come with is cellulite, as I mentioned, as more than 80% of women, even if you're thin, you do get cellulite. And we treat cellulite. We try and improve it. It takes a few treatments, and then once you've actually had all your treatments, you actually have to maintain it. You can't just think this is all going to go away, because it's a combination of problems. As I said, it's a microcirculation problem, it's a lymph drainage problem, it's a skin problem, and it's a fat problem. So, and all these technologies that are out there, if you do just a single modality, you will get a little bit of an effect. But the big results come when you actually start combining treatments, and you start in one same treatment session, and that's when you start getting results.
Okay. We've got an SMS here from Kelly. She says, I have never really discussed this, but I spend hours in front of the mirror every day looking at the long lines under my mouth. What can be done about that?
Oh, my goodness. Okay. Is this Kelly?
Kelly,
you can do a procedure called a dermal filler. I mean, it takes a few minutes to do. It is quite pricey, and it does not only last 6 months. When you place that dermal filler under the skin in the dermis where it belongs, that effect of that filler in the dermis actually puts pressure on the cells that make collagen, and it actually stimulates your own collagen and puts your collagen back. So even though the filler may be gone, it may be dissolved within a year or 15 months, the effects of the filler are there. And then also, once the filler starts breaking down, it produces these small fragments of hyaluronic acid, which also stimulate collagen. So it's a misconception that fillers only last 6 months. They don't. I mean, I've done patients 3-4 years ago, and they come back and they say, "Look, doctor, my filler lasted so long." And I said, that's exactly what we expect. But depending on how deep that line is, if the line is deep, you might need a repeat filler to get it back to where you want it to be.
But you can definitely treat those.
No, absolutely, you can treat. I mean, fillers are the big thing. At this congress now, it was all about fillers and replacing the volume, because people can see that they're aging. They can see. I love it when they come with their ID books and they say, "Doctor, what happened to my face 10 years ago? Look what I look like, and look what I look like now." They can recognize wrinkles, but they don't appreciate that they're actually losing volume in their face. And volume is one of the biggest contributors of facial aging. They lose their shape. Their cheeks start falling down, together with gravity and loss of collagen, but it's actually the loss of bone, loss of fat,
Everything.
Everything starts collapsing down, and you need to put your volume back in your face.
You've got some fan mail here. It says, Dr. Allem, I've been a patient of yours, and I want to tell you what a difference the procedure has made to my life. I'm convinced that my new job is because of the confidence I have with regard to my appearance. So,
that's what I love about my job. Thank you. It may be pricey, but really you can't believe what it does for a person's self-esteem. And, a simple thing, if you're having a bad hair day, you go for a fabulous blow dry, and don't you feel better about yourself? And that's just one small little thing. So that's how these procedures can change your face permanently,
But how, the other part of it, perhaps this part where we started and we have spoken about throughout the show, unrealistic expectations that people feel that maybe they come in, they have a few pricks, they pay a lot of money, and their lives are going to change. I'm sure you get that. Maybe even more than the plastic surgeons do, because it's so instant.
What you have to explain to them that, as I always say, I'm a physician, not a magician. And I tell women,
say that again.
I'm a physician, not a magician. I can't fix your face with one filler. And you set a plan out for them. Some people can do it all at once. Some people can do it slowly. Some people don't want such a dramatic change. There was a whole debate in this Monte Carlo Congress where we had a Canadian doctor who does between 12 and 16 fillers in a session, and this Milanese plastic surgeon who says we don't do it like that. We do it slowly. We do 2-3 fillers. So, but there's a place for both. Some people haven't got time. They want it, they want the instant result. Some people want to change their faces slowly so that people don't really realize what's happening. But it's so amazing when people ask me, how long does Botox last? I'll say, okay, we give you the Botox, and you'll see for yourself. The first week you go out there, the compliments will start flying. You'll get compliments that you've never received before, and that'll really boost the person. And then 3, 4, 5 months later, when the Botox starts wearing off, all of a sudden the compliments start disappearing. Then, whoops, you're back again for a little Botox, and the compliments are back. And they laugh. They say, that's exactly what happens. You can't believe how it just changes the face. And people just say, you look so great. What did you do? Your skin shining. You look relaxed. What did you do? Did you go on holiday? It's quite amazing what the Botox does. And it's great to get compliments. Who doesn't like to get compliments?
Absolutely. So we've got an SMS that I'd like you to answer just before the end of the show, and it's from a guy, and he says, I've been wanting to do some of these procedures, but I'm embarrassed to come there. I think what he's concerned about is the element of privacy in the clinics, and as a guy, perhaps it's even more not wanting to be seen and so on.
Look, that's why we always have clinics. We try to get our clinics where you can park right outside. You don't have to walk through a busy shopping mall, because people don't want people to see what you've had done. And believe me, the one day there were no women sitting in the surgery. There were only men. I mean, it was quite a joke, and they felt quite comfortable.
Okay about it.
And the one, like a bank executive, was having a huge conversation with one of the patients there. It's actually made friends. So, you just have to choose the right location where you can get privacy. You don't have to go through busy shopping malls, and you can just run out and dash to your car.
Thank you very much. I will ensure. Thank you very much to our wonderful producer Jean for helping, and SK for controlling the show. Great team here, and we will put your contact details onto our website, so thank you very, very much for that. I remember long ago in one of the little business books, actually, it was Ken Blanchard who said that people who feel good about themselves produce good results. If your appearance is something that is worrying you, and that perhaps you can do something about, that will make you feel good about yourself, well, I hope the show has been a little bit enlightening for you, and thank you very, very much for your time, your expertise, the work that you do, and for being with us on the couch on 101.9. See you next week. Chai FM.